Hi, everyone. This is Nurse Anna from nursestudy.net, and I think we're about halfway through our cardiovascular series. Today, we're going to be doing congestive heart failure, 25 questions with answers and rationales. Enjoy. Before I forget, I do have free audiobooks via A6 Audible. All you need to do is look at the link in the description, and it's a free 30-day trial. You can get through the book within the 30 days. So please utilize this to get more questions for NCLEX NGN that you can listen to in your car or in the library.
Question 1. A client with left-sided heart failure reports shortness of breath and orthopnea. On assessment, you auscultate crackles in the lung bases. Which medication should you anticipate the healthcare provider ordering first? A. Digoxin. B. Furosemide. C. Spironolactone. D. Metoprolol. Answer and rationale. B. Furosemide. Furosemide is a loop diuretic that will help reduce pulmonary congestion by eliminating excess fluid from the body, a primary issue in left-sided heart failure. Digoxin and metoprolol are used to control heart rate, but they do not address the immediate concern of fluid overload. Spironolactone is a potassium-sparing diuretic, but furosemide is more effective for rapid fluid reduction. Question 2. A 60-year-old male with a history of chronic heart failure presents to the emergency department with complaints of significant lower extremity edema, weight gain, and fatigue. Which clinical finding would indicate right-sided heart failure? A. Pulmonary crackles. B. Jugular vein distension. C. Tachypnea. D. Elevated troponin levels. Answer and rationale. B. Jugular vein distension. Right-sided heart failure is characterized by systemic venous congestion, leading to jugular vein distension, peripheral edema, and ascites. Pulmonary crackles and tachypnea are more indicative of left-sided heart failure. Elevated troponin levels are associated with myocardial injury, not specifically heart failure. Question 3. A client with heart failure is receiving an infusion of dobutamine for acute decompensation. What is the primary nursing assessment when administering this medication? A. Monitoring serum potassium levels. B. Assessing heart rate and blood pressure. C. Evaluating urine output. D. Measuring daily weight. Answer and rationale. B. Assessing heart rate and blood pressure. Dobutamine is a positive inotropic agent that increases cardiac output but can cause tachycardia and hypertension, requiring close monitoring of heart rate and blood pressure. While serum potassium and urine output are important, they are not the primary focus when administering dobutamine. Question 4. A client with heart failure is being educated on a low-sodium diet. Which food choice indicates the client understands the teaching of choosing appropriate food? A. Canned soup. B. Pickles. C. Fresh fruit. D. Deli meat. Answer and rationale. C. Fresh fruit. Fresh fruit is naturally low in sodium, making it an appropriate choice for a client on a low-sodium diet. Canned soup, pickles, and deli meat are typically high in sodium and should be avoided by heart failure clients. Question 5. A client with a history of heart failure is being treated with lisinopril. Which laboratory value should the nurse monitor closely due to the risk associated with this medication? A. Serum sodium. B. Serum potassium. C. Blood glucose. D. Hemoglobin. Answer and rationale. B. Serum potassium. Lisinopril is an ACE inhibitor that can cause hyperkalemia by decreasing aldosterone secretion, leading to potassium retention. Monitoring serum potassium levels is critical to prevent cardiac complications. Sodium, blood glucose, and hemoglobin are not directly affected by ACE inhibitors. Question 6. A client with heart failure reports increased fatigue and difficulty breathing at rest. What assessment finding would most strongly indicate worsening heart failure? A. S3 heart sound. B. Elevated blood pressure. C. Capillary refill of 3 seconds. D. Resting heart rate of 80 beats per minute. Answer and rationale. A. S3 heart sound. An S3 heart sound is often a sign of worsening heart failure due to the rapid filling of a dilated left ventricle. Elevated blood pressure and capillary refill may suggest other issues, but they are not specific to worsening heart failure. A resting heart rate of 80 beats per minute is within the normal range. Question 7. A client with chronic heart failure is prescribed carvedilol. What is the most critical nursing action prior to administering this medication? A. Assess respiratory rate. B. Monitor blood glucose. C. Check apical pulse. D. Evaluate lung sounds. Answer and rationale. C. Check apical pulse. Carvedilol is a beta blocker that can cause bradycardia, so it is important to check the apical pulse before administration. If the pulse is below 60 beats per minute, the nurse should withhold the medication and notify the healthcare provider. Respiratory rate, blood glucose, and lung sounds are less directly affected by this medication. Question 8. A client with heart failure is receiving spironolactone. Which potential complication should the nurse be most concerned about? A. Hypernatremia. B. Hypokalemia. C. Hyperkalemia. D. Hypocalcemia. Answer and rationale. C. Hyperkalemia. Spironolactone is a potassium-sparing diuretic, and the major risk is hyperkalemia, which can lead to dangerous cardiac arrhythmias. The other electrolyte disturbances are less likely with this medication. Question 9. A client with decompensated heart failure is started on intravenous nitroglycerin. Which clinical parameter should the nurse monitor most closely? A. Urine output. B. Blood pressure. C. Blood glucose. D. Serum creatinine. Answer and rationale. B. Blood pressure. Nitroglycerin causes vasodilation and can lead to significant hypotension. Monitoring blood pressure is essential to ensure it remains within safe limits. Urine output, blood glucose, and serum creatinine are important but not as immediately affected by nitroglycerin administration. Question 10. A client with left-sided heart failure is admitted with worsening dyspnea and frothy pink sputum. What is the priority nursing intervention? A. Administer IV morphine. B. Place the client in high Fowler's position. C. Start an infusion of dopamine. D. Administer fluid bolus. Answer and rationale. B. Place the client in high Fowler's position. High Fowler's position helps to improve oxygenation by promoting lung expansion in a client with pulmonary edema, which is causing the frothy pink sputum. Administering morphine or dopamine may be appropriate later, but improving oxygenation is the immediate priority. Fluid bolus would worsen the condition. Question 11. A client with chronic heart failure is receiving digoxin. The nurse notices that the client has developed nausea, vomiting, and a heart rate of 52 beats per minute. What should be the nurse's priority action? A. Administer antiemetics. B. Increase fluid intake. C. Hold the next dose of digoxin and notify the healthcare provider. D. Encourage the client to rest. Answer and rationale. C. Hold the next dose of digoxin and notify the healthcare provider. Nausea, vomiting, and bradycardia are signs of digoxin toxicity. The priority action is to hold the medication and notify the provider. Administering antiemetics or increasing fluids would not address the underlying toxicity, and rest does not resolve the issue. Question 12. A client is being discharged after a hospitalization for acute heart failure. Which instruction is most important to include in the discharge teaching to prevent future exacerbations? A. Increase daily intake of protein. B. Weigh yourself daily and report any weight gain over 2 pounds in 24 hours. C. Perform heavy lifting to improve cardiac output. D. Restrict potassium intake to prevent hyperkalemia. Answer and rationale. B. Weigh yourself daily and report any weight gain over 2 pounds in 24 hours. Daily weights help monitor fluid retention, a common issue in heart failure. Sudden weight gain indicates worsening heart failure and should be reported. Protein intake and potassium restriction are less relevant for most heart failure clients unless on specific medications. Question 13. A client with heart failure is prescribed both furosemide and lisinopril. Which electrolyte imbalance should the nurse monitor for most closely in this client? A. Hypercalcemia. B. Hypokalemia. C. Hypernatremia. D. Hyperkalemia. Answer and rationale. B. Hypokalemia. Furosemide, a loop diuretic, causes significant potassium loss, leading to hypokalemia. Lisinopril can cause hyperkalemia, but the risk is more immediate with the potassium wasting effects of furosemide. Question 14. A client with heart failure is receiving IV milrinone for acute decompensation. The nurse notes that the client has developed a new arrhythmia. What is the most likely cause of this new arrhythmia? A. Excessive potassium loss. B. Increased cardiac output. C. Reduced afterload. D. Direct effects of milrinone on cardiac muscle. Answer and rationale. D. Direct effects of milrinone on cardiac muscle. Milrinone increases contractility and can lead to arrhythmias as a side effect. The other options are less relevant, as milrinone's primary mechanism is through its effects on the heart muscle and vasodilation. Question 15. A client with right-sided heart failure is being evaluated for worsening symptoms. Which laboratory result would most strongly suggest worsening heart failure? A. Decreased hemoglobin. B. Increased B-type natriuretic peptide, BNP. C. Elevated white blood cell count. D. Low albumin. Answer and rationale. B. Increased B-type natriuretic peptide, BNP. BNP is released in response to ventricular stretching and volume overload, common in heart failure. An elevated BNP level suggests worsening heart failure. Hemoglobin, white blood cell count, and albumin levels are not directly related to heart failure. Question 16. A client with acute heart failure is prescribed dobutamine. What is the nurse's priority assessment while administering this medication? A. Capillary refill time. B. Blood glucose levels. C. Cardiac output and urine output. D. Serum calcium levels. Answer and rationale. C. Cardiac output and urine output. Dobutamine is a positive inotrope used to increase cardiac output, which should improve perfusion and urine output. Monitoring these indicators helps assess the effectiveness of the drug. Capillary refill, blood glucose, and serum calcium are less directly related to dobutamine's effects. Question 17. A client is admitted with worsening heart failure. The client's oxygen saturation is 88% on room air, and they are experiencing dyspnea at rest. What is the nurse's priority action? A. Administer oxygen via nasal cannula. B. Elevate the client's legs. C. Administer morphine. D. Provide a fluid bolus. Answer and rationale. A. Administer oxygen via nasal cannula. The client's oxygen saturation is below normal, and they are dyspneic, indicating the need for supplemental oxygen. Elevating the legs and administering fluids would worsen pulmonary congestion, while morphine is not the first-line intervention. Question 18. A client with left-sided heart failure is prescribed an angiotensin II receptor blocker, ARB. Which adverse effect should the nurse be most concerned about? A. Cough. B. Hyperkalemia. C. Hypoglycemia. D. Increased urination. Answer and rationale. B. Hyperkalemia. ARBs, like ACE inhibitors, can cause hyperkalemia by inhibiting the renin-angiotensin-aldosterone system. Cough is more associated with ACE inhibitors, and hypoglycemia or increased urination is not commonly associated with ARBs. Question 19. A client with decompensated heart failure is placed on fluid restriction. What is the best indicator that the fluid restriction is effective? A. Decrease in heart rate. B. Increase in urine output. C. Decrease in daily weight. D. Improved appetite. Answer and rationale. C. Decrease in daily weight. Daily weight is the most reliable indicator of fluid balance in heart failure clients. A decrease in weight suggests reduced fluid retention. Heart rate and urine output may improve but are not as reliable as weight monitoring. Question 20. A client with heart failure has an ejection fraction of 35%. Which symptom would most likely be present? A. Hypertension. B. Cyanosis. C. Fatigue and dyspnea. D. Hyperthermia. Answer and rationale. C. Fatigue and dyspnea. A reduced ejection fraction indicates poor cardiac output, leading to fatigue and dyspnea due to inadequate perfusion and oxygenation. Hypertension and hyperthermia are not direct consequences of low ejection fraction, and cyanosis occurs later if hypoxia becomes severe. Question 21. A client with chronic heart failure is prescribed metoprolol. Which assessment finding requires the nurse to hold the medication and contact the healthcare provider? A. Blood pressure of 110/70 mm of mercury. B. Heart rate of 48 beats per minute. C. Blood glucose of 140 mg per deciliter. D. Respiratory rate of 22 breaths per minute. Answer and rationale. B. Heart rate of 48 beats per minute. Metoprolol is a beta blocker that can cause bradycardia. If the heart rate is below 60 beats per minute, the medication should be withheld, and the healthcare provider notified. The other parameters do not contraindicate metoprolol use. Question 22. A client with heart failure is receiving education about medications. Which statement by the client indicates a need for further teaching? A. I will weigh myself every day at the same time. B. I should notify my doctor if I gain more than 2 pounds in 24 hours. C. I can stop my beta blocker if I feel better. D. I need to avoid adding salt to my food. Answer and rationale. C. I can stop my beta blocker if I feel better. Beta blockers should never be abruptly stopped as this can cause rebound hypertension or worsening heart failure. The other statements indicate appropriate understanding. Question 23. A client with advanced heart failure is considering a heart transplant. What should the nurse include in the pre-transplant education? A. You will not need to take any medications after your transplant. B. You will need to take immunosuppressant medications for the rest of your life. C. Heart transplants guarantee a cure for heart failure. D. Your physical activity will be permanently limited after the transplant. Answer and rationale. B. You will need to take immunosuppressant medications for the rest of your life. After a heart transplant, clients must take immunosuppressant medications to prevent rejection. It is not a cure, and physical activity can often improve after recovery, not be permanently limited. Question 24. A client with heart failure is being treated with hydralazine and isosorbide dinitrate. Which side effect should the nurse monitor for closely? A. Hypertension. B. Dizziness. C. Bradycardia. D. Hyperglycemia. Answer and rationale. B. Dizziness. Hydralazine and isosorbide dinitrate are vasodilators, which can cause dizziness due to hypotension. Bradycardia, hyperglycemia, and hypertension are not typical side effects of these medications. Question 25. A client with end-stage heart failure is receiving palliative care. What is the nurse's priority intervention? A. Administering opioids to relieve pain and dyspnea. B. Encouraging the client to continue daily weight checks. C. Providing education on aggressive treatment options. D. Scheduling the client for cardiac rehabilitation. Answer and rationale. A. Administering opioids to relieve pain and dyspnea. In palliative care, the focus is on comfort, and opioids are commonly used to relieve pain and manage dyspnea in end-stage heart failure. The other options are less appropriate in the context of palliative care.